There's several different models for approaching the surgery and preparing the patient medically for surgery. Mrs. Ward is kind of a particularly talented complex care provider, and there are many parents who are their child's best complex care provider, and there are other parents who rely upon a system. And I think increasingly we would like to have a system in place, where we don't force the parents to do all of the preparing. It's easy for the surgeon to kind of say, well, come and see me when you've got this fixed out and that fixed out, and go and see those people and report back to me. That's not the best way to do it, and I think we can work toward a better model. All right, and I think we have worked toward a better model.
That's right. That's right. I think thinking about, regardless of whatever system you're in or the attributes that sort of lead you to consider the surgery, trying to figure out what it would be like to have at least one person on the provider side actually take charge of the process. And maybe in certain situations that's the surgeon. We've seen it other times with preoperative anesthesia providers stepping up, or maybe it's general pediatrics or a specialist or someone that just becomes the point person that is sort of watching the child and family through the entire process, making sure that everything gets done and is thought about in a concerted effort in a high quality way to make the decision, prepare the child and family for surgery. Mm-hmm. Speaking for the anesthesiologist, I think a lot of them experience a pretty high level of anxiety when these very, very complicated children are coming through with neuromuscular scoliosis and 10 additional chronic conditions, and they're on 15 medications and using a lot of durable medical equipment at home, and it's very difficult to assess their baseline level of health. And then, oh, by the way, they're going to undergo this very physiologically stressful operation in a week, and me, anesthesia provider, are meeting them for the first time. And I essentially have 3 or 4 days to do anything ahead of the surgery if I find things that need to be addressed. So figuring out how to get those providers more involved upstream, and thinking about these children in particular, I think could be very helpful. And if anyone out there has the opportunity to make that happen in the decision-making process and preparation process, would be a good thing.